Steve Sherlock here for Franklin Matters, Franklin Public Radio, available anywhere, anytime on the internet, WFPR.FM, and in the local Franklin, Mass. FM radio dial 102.9. Here today, virtually, with another candidate interview for our 2025 biennial election coming up November 4th. This time, a Board of Health write-in candidate, Diane Daddario. Diane, how are you doing today?
I'm doing just fine, thank
You're
you.
doing fine. Of course you are. So, voting is already underway for in-person. Mail ballots are out. Mail ballots are coming in. The big day is coming up a week almost,
Yeah,
November
almost.
4. So, we're going to get your info out so that people can say, oh, that's who Steve talked to. That's Diane. If I hadn't met her, now I know more about her. So, tell us a little bit about your Franklin story. Your road to or life within Franklin and your involvement in the community here so they'll know who we're talking to.
Okay. Well, I was born in Franklin to Jack and Marie Daddario. I'm the oldest of six and part of a very big extended Italian family and who've been here for a few generations. So it was a great place to grow up. The Franklin's filled with people who really care about each other and about their community. I really enjoyed being here. I graduated from Franklin High School in 1978, and I went on to pursue my dream of becoming a doctor, which actually I wanted to do since I was in elementary school. Um, I took the long road. I majored in biomedical engineering, and I went to graduate school, and I worked for a little while as a biomedical engineer before I went off to medical school. And I met my husband, John Jardine, at Rhode Island Hospital, where we both did our emergency medicine residencies. And eventually we ended up on the Cape, where our daughter Anna was born.
Hmm.
So in 2005, we decided to move back to Franklin so that Anna could get to know her family, grow up in this great town,
Hmm.
go to the Franklin schools. She played field hockey because Franklin's the best place to play sports. Um, so it was wonderful. I became involved in whatever I could in my spare time. I was a room parent, I was a team parent, I was a Girl Scout leader, and I have been volunteering at the food pantry. I still do that today.
Hmm.
And um, and then I became involved with the health department. And first in 2009, when I was asked to help set up the vaccine clinics for the H1N1 influenza
H1N1,
virus.
yes. Yep.
Yeah, and um, and I also helped with the COVID vaccine clinics along with the
Hmm.
fire department. It was a great collaboration, and I've been helping out with the flu vaccine clinics ever since.
Hmm.
So I really love it.
Yep. Yeah, there's a couple of cool connection points there. I'm also the oldest of six, but we're
Oh
more
yeah,
French and Irish between mother and father. But I had 75, six first cousins. So yeah, we had a large family too.
wow, that's a lot. Yeah,
But we found our way here in 95, I think it was. Yeah, so it's like 30 years we've been here. So yeah,
wonderful.
I'm not a native, but I'm close.
Close. Yeah, 30 years is a long time.
Yeah, picked up a lot along the way.
Mm.
Yes. And then actually in 2007 is when I really started doing this. So I do remember the reporting on the H1N1,
Ah,
because that was breaking news. And then of course COVID. During
yes.
COVID, Kathy Liberty and I had a few, and then certainly Jamie Helen and I did. I think we were on a twice a month regimen because things were just changing so frequently.
Yes. Yeah.
Yep,
It was quite a time.
quite a time. Lots of lessons learned.
I hope. I
We hope.
hope.
We hope. Yeah, we'll get into that because that's coming up. But
Ah,
in terms of a question, hopefully not in the future.
right.
So clearly in Franklin, while some of the civil discourse, at least on the national level with the party politics, seems to be going all over the place because we have a nonpartisan election, politics is still local. We still want to have a civil conversation because we're all neighbors. Some of us are neighbors closer than others, but
Mm.
we need to figure out what's going on. So what in your role would do to help that civil discourse?
Well, I mean, I know what we see on television, on social media, people Google anything. Everybody's given their opinions about what is right and wrong, about
Hmm.
medical issues, medical treatments, and this is what I can address. I mean, the information that's out there, it can be conflicting, it can be very misleading, and it generates a lot of fear in people, and they just don't know where to turn. So I see a lot of these people in the emergency department. That's usually where they come when they have a lot of questions or problems. I've
Hmm.
been an emergency medicine doctor now for going on 33 years. And so I see a wide variety of people, different ages, different cultures, health conditions, and they all come with a lot of questions.
Hmm.
So, I mean, just to make it clear, medicine isn't an exact science, and the answers aren't always easy to figure out. But as physicians, we practice evidence based medicine. It's based on scientific research and years of experience.
Hmm.
So, for example, vaccines have become a political issue.
Right.
People, they're forgetting the science and the history behind these vaccines. Um, we I mean, they work. We have completely eradicated smallpox because of mass vaccination programs. We've just about totally eradicated polio for the same reason.
Hmm.
And we also saw just recently in 2009 that we prevented a flu pandemic by not only vaccinating the majority of people, but just as important, teaching them how to prevent getting ill, and
Hmm.
if ill, how to avoid spreading the disease.
Correct.
Health education is very important. So, the way I see it, the way I can help with what's going on in society is just to address people's fears and their confusion and answer their questions honestly and accurately without pushing a particular political agenda
Hmm.
so that my patients are able to make informed decisions on how they want to proceed with their medical treatments. Don't make any judgments. I just put it out there as clearly and as simply as I can. So I hope I can bring that perspective to the Franklin Health Department and continue working on keeping Franklin healthy.
Yes. Amongst being safe and popular and wanted, health certainly will take us a long way. So
Yes.
thank you for that. So I think you've touched on it a little bit, and actually in a lead into this, how in your early youth did you decide you wanted to be a doctor?
I don't know.
It
Um,
just stuck and
it
you
may
just
have
wanted
been,
it.
it may have been, I think that I was fascinated by our family doctor, Dr. Crowley, who had an office right next to the old fire station. We
Okay.
used to just walk up the street, and because we lived close by,
Hmm.
and I used to love just going into his office, and he would let me play with his stethoscope, and he would, and he just, I don't know, I just that's when I started to fall in love with it, um, and I mean there were other things too. I mean, I went to an emergency room once when I was 9 because I had a cut and I needed stitches.
Hmm.
And again, I thought that was just so fascinating, even though I was hurt. But it was, but still, it just made an impression.
Hmm.
And, books that I read and the way that doctors were spoken about, I just thought it was just a wonderful thing to do.
Hmm.
So,
Yeah. No, thank you for
never,
that. So the one Board of Health question is the health department certainly came to the forefront, to the front line really during the COVID pandemic, which we mentioned. With the pandemic mostly behind us. In your role as oversight for the department, what do you see as the next step of the department in bringing and continuing to help the community maintain good health?
I think that we do have to continue to provide education about people's health, what they can do to continue to be healthy, to, even though we say that, well, the pandemic is over, and it is, but it has opened a lot of doors to other questions and other problems. And a lot of people are getting maybe a little too relaxed about it, so
Hmm.
that we have to just keep reminding everyone that certain things need to be done in order to keep our kids safe in school, so that they don't have to worry about getting ill there, and then there's just another whole
Hmm. Yeah,
um,
because the COVID virus itself continues to morph, and it's those basic health protocols, whether hand washing, masking, distancing, all of those things still have a role to play, even though the quote, the pandemic's over, the virus is still here and
the
continuing to morph.
the virus is still here, and we still need to get our COVID vaccines. The one and done doesn't exist.
Hmm.
We need to be vaccinated. I mean, most people do get their flu vaccine once a year. They have to start thinking about getting their COVID vaccine once a
Right.
year, um, and um, and still be careful, because it is out there. Even if you're vaccinated, you can still get COVID. You can still get the flu.
Hmm.
You're just not going to get it as bad as if you weren't vaccinated. So we can't be lax in out in public. We still have to be careful
Hmm.
about what we do, as far as, again, if we're ill, we want to take precautions so that we're not spreading it to everybody.
Right.
And there's a lot we can do to prevent ourselves from getting it. And vaccination's the first step. There are problems now with other things other than flu and COVID. I mean, there are measles outbreaks. I'm
Hmm.
seeing chicken pox. I'm seeing this because we have people in our community, more and more now, who aren't vaccinated, who are
Right.
from places where they don't get vaccinated, or they just chose not to be vaccinated. So
Right.
that means that diseases that maybe we haven't seen in a long time, we're starting to see again.
Hmm.
So we have to be vigilant, and we have to teach people that. And I don't want to spread fear. I don't want, but I do just want people to be aware that they still have to be careful.
Hmm. Yeah, I think, the washing the hands, washing the face, the distancing protocols is in crowded situations, masking as necessary, certainly
Mm-hmm.
not even going out if you're ill. Those are a lot easier steps to take, I think, than, having to suffer.
I know, I know. But we all get lazy. And so we just need reminders, and
Hmm.
I'd
Yep.
like to help do that, give reminders.
Give reminders, gentle
Yeah.
fact-based reminders.
And if we can just, work on still running these vaccination clinics, it would be great if we can continue to do it. I know that it's a little more difficult now
Hmm.
because the government's not funding much of anything.
Right.
So it is a decision, and it could be, start to be costly for community. So we have to, um, there's a lot to talk about, and we have to continue to watch out for it. So,
Agreed. Yeah, that'll be another topic for another day with between the Board of Health and eventually with the town council and determining the budget and priorities. should it come to that.
Right.
That'll be a discussion point for sure. So while we've discussed certainly your basic background, your history as a doctor and COVID and the role of the health department, is there something else that you want to talk about that we haven't yet discussed? Or just use the time to make your closing statement.
Closing statement. Well, I just want to thank you so much for giving me this opportunity. And I want to thank everybody who's given me their support. It's been overwhelming. I've been hearing from a lot of people and it's been wonderful.
Well, you have, from what I've heard through the grapevine and others in different persons, you've got a reputation with your work that you've done for the Board of Health prior. So it would kind of make sense to do that. And again, I'm sharing that info. I'm just creating the information. I'm not providing an endorsement. I don't do that, but it is a fact that's out there. So you've corroborated that as well. So thank you for that.
Yeah.
And thank you for taking time to share your story, because it is an important decision for all of us as residents and voters to make on or before November 4. So thank you again. And to the listeners, thank you
Thank
for
you.
participating. We'll include a slide at the end of the video with Diane's contact info. So if there's any other questions or information you'd like to follow up with, you can certainly do that. And a quick reminder, we do this because Franklin matters.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.